Hey y'all, Chad Robbins here with the Weekly Skinny. Today's topic is labiaplasty. This is one of my favorite operations for several different reasons. First of all, compared to a lot of things we do, it's not as invasive. It doesn't take as long to recover. And I like it also because it can be done under lighter levels of anesthesia. Yes, for many cases, we still put people asleep because they want to be asleep. But it's one of the things that we can do under local anesthesia very comfortably. And there are some in-between levels too, where you can do local anesthesia, which is lidocaine, bupivacaine, and things like that with some oral sedation. So that gives us the option to do that in the clinic side or in the OR. At any rate, it's a great operation, and for the people who need it, it makes a tremendous difference. It's also something that a lot of women don't talk openly about. I know that women talk openly about their breast and other things that we do in plastic surgery, but still many people feel bashful and modest about talking when it comes to talking about this particular topic for obvious reasons. But labiaplasty is the reduction of the labia minora, and in many cases the pexia reduction of the clitoral hood. Now there are other types of labiaplasty, but this is the most common type. And there are two main techniques to address this problem. One is called the trim technique, which is where if you pull the labia minora out to length, people just trim and sew over that edge. There's also something called the wedge technique, and I use both. I have a preference for one versus the other in particular cases. If I'm addressing clitoral hood redundancy, that's where the skin around the top of the clitoris is redundant. Of course, that skin, you may remember, is contiguous with the labia minora. I'm very much more likely to use the wedge technique because I like the way that pexies it open and gets that redundant skin, so it minimizes the risk for any transitions between the minora and the clitoral hood. But it's a great operation. It doesn't take very long to do it, about an hour to an hour and a half, depending on the case. People go home same day. There's not a lot of aftercare involved, just some topical ointments and, of course, wearing a pad. You do have to avoid sexual activity for 6 weeks, but physical activity you can get back to after 2 weeks. All the stitches are dissolvable. You don't have to come back and have stitches removed. Of course, no drain tubes or a lot of the things we use in plastic surgery that people don't like. There are none of those involved in labiaplasty, and it tends to be relatively low risk. To find out whether you're a good candidate or not, we need to see you do an exam. Of course, the exam is completely external. We're not going inside your vagina or anything like that. There's no digital exam involved, and we'd be happy to see you if that's something you're interested in. But thanks for tuning in. Hope we answered your questions.